Good afternoon, friends, Facebook friends. My name is Mrs. Steven. On this platform, I'm popularly known as Mrs. Ankuma. I'm a public health nurse professional. Today being the 4th of February 2026, and every other 4th of February is known as World Cancer Day. So I want to use this opportunity to reach out to my friends in Facebook and the general public on cancer awareness. There are a lot of people speaking today concerning cancer awareness, for us to know that cancer is real and has become a public health concern because of the way cancer is ravaging people out there. And cancer does not spare anybody. It happened to different ages. Children from 0 to 14 encounter, when I say 0, right from the womb, adults, average age, old people. Cancer does not spare anyone. And the thing of concern with cancer is the recent steady increase in new cases of cancers. And cancer happens to every part of human body. What I mean, different system. You know, the body constitutes of, let me start from the middle. We know that the cell is the smallest component of human body. Cell made of tissues. And then these tissues, there are different parts of the body that are made up of, different tissues. And then this group of tissues form different organs, and these different organs form different systems. And then the human body is made up of different systems. So there's no part that cancer does not occur, even though there are certain parts of the body that it's very rare. It does happen when it travels from certain aspect where it originally started and then to certain aspect of the body. Okay, there are several myths concerning cancer. People have different perspectives. You hear people saying different things from the community. Things like cancer cannot be cured. Things like cancer is not even real. Is an arrow, from somebody to somebody. Is somebody encountering evil spirit. Some will even tell you that if cancer is not to be taken to the hospital for treatment, that if an individual dare go to the hospital and they treat the person with orthodox medicine, the person will not make it. Cancer is for traditional, for somebody to be treated traditionally, and so on and so forth. And so because of this, some look at it as a death sentence. I see once somebody is diagnosed with cancer, that person cannot be cured. I want to assure you that cancer is curable. People can be cured from cancer. There are people that have been diagnosed with cancer that have been cured, but there's a reason why they were able to cure them of cancer, because they reported to the hospital very early. So the essence of this, to follow my co-medical professional to raise awareness. The purpose of this video is to raise awareness on the different way that we can actually prevent even the occurrence of cancers to some extent, and then those that have already developed the process of having cancer, once they present to the hospital early and they are able to diagnose them early, that they can actually be cured of cancer. Because we have survivors, we call them survivors, people who were initially diagnosed with cancers and went through treatment. They were able to present to the hospital early enough. They were able to diagnose it early enough. They went through some process of treatment, and then today they have been declared cancer free and have lived their life for some reasonable number of years, without manifesting anything, a sign of cancer. And there's this common saying that prevention is better than cure. Me, I say prevention is cheaper than cure. Not only in terms of cancer, even other disease conditions. Once people are diagnosed early, the prognosis is good. That is, the outcome is good. Let me give you, like, for instance, somebody being diagnosed with high blood pressure. Blood pressure primarily is a cardiovascular disease, that is the disease of the heart and the blood vessel and the blood itself, where the pressure become abnormal. Now, it's primarily a disease of the cardiovascular, but I tell you, once it become chronic, there are other organs that can pay the consequence. Something like the kidney that regulates, endowed with the responsibility to regulate blood pressure, can be affected because somebody have not been diagnosed and treatment commence, with high blood pressure. The kidney can become involved. That person kidney can actually be in trouble because of that. So the essence of this is not to teach freshly, want to teach someone anatomy, to tell you that I have knowledge of anatomy. No, that is not the essence. The essence of this is to raise awareness, to remove that mindset, the things that people have heard as far as this condition is concerned, and to also let you know that once somebody is able to present early, that something can be done, and that there is no such thing as if you present. I've also had that thing concerning, like, dental caries. When people don't present early and then there are multiple holes in the teeth, they will tell you, don't go to the hospital to remove that. Once they remove one teeth, that's how you keep removing your teeth. So it's not only concerning cancer that you hear, different myths, different perspective concerning it, what people say in the community, but the essence of this video, I want to make it as concise as possible. I want to be able to mention from the world, the world perspective. I'm not narrowing it to Nigeria, neither am I narrowing it to Africans. Even in the African, sub-Saharan African, because sometimes when you want to discuss disease, you break it down, to this level. I just want to, because today is World Cancer Day, I want to generalize, that is the world, from the world perspective, to see what are the top most occurred cancer in terms of morbidity. That is the type of cancer disease that mostly happen to men in the whole world, from the top in the list to the least, that is the fifth one. There are so many others, but I just want to single out the top most occurred in men, in women, that is adults, and then children from 0 to 14. Okay, so from this list, I want to try as much as possible to reduce the use of medical terminologies, because I know that my audience constitutes of those that are medical practitioners and the general public that have nothing to do with medicine, so that this message is passed across, most especially to the non-medical that is health practitioners, to raise awareness that these are the things people should do in daily things that people should do to not even allow these cancers to the process to start. Because the thing is that the specific cause of cancer is idiopathic. We don't really know, but there are some factors that when people are predisposed to those factors, especially in terms of quite a number of those factors, and then in terms of the durability of being exposed to certain of those factors that people develop cancers. Now, in the list, I have first in the list that one of the cancers that are mostly seen in male, mostly seen in male, that is mostly diagnosed. I told you I'm going to be talking about concerning the morbidity, that is disease occurrence, in terms of incidence of disease occurrence, and then in terms of the one that mostly kill men. Men are seen worldwide. The first one on the list now in terms of morbidity, disease occurrence, is prostate cancer. Prostate cancer top the list, then followed by lungs cancer, followed by colorectal cancer, that is cancer of the colon and the rectum. Then because I'm not going to treat all, I will just pick one. Like this prostate cancer is topping the list in terms of incidence of the morbidity, that is disease occurrence. So I will talk about it, not to make this video too lengthy. I will do another video to talk about the second one, that is the lung cancer, that is seen to be among the most deadliest, that quite a number of men die from it. I hope it's very clear. So in terms of most disease occurrence, the one that top the list is prostate cancer. Most men are diagnosed with prostate cancer. Then the one that follow is lungs cancer, colorectal cancer. Then you have the liver, cancer of the liver or liver cancer. Then you have the fifth on the list, that is the stomach cancer, that is gastric cancer. When we say stomach, we mean it's part of the abdominal organs, okay? You know, some people refer to their abdomen as stomach. This is abdomen, the one you see from the outside like this after the chest. But there's an organ that is enclosed in the abdomen that is called the stomach. Anatomically, that is gastric cancer. So those are about the five most happened, let me put it like that, most happened cancers that are seen among men. Then you have like the second aspect I said I'm going to be talking about has to do with, among these five most occurred cancer, which are the one that top the list of cancer mortality, that is death as a result of cancer in men, first five. So I'm going to be listing them. You have the first one that top the list in terms of death now worldwide is the lung cancer. Then after the lungs cancer, it's followed by liver cancers, followed by colorectal cancer, prostate cancer the fourth, and then the stomach cancer still retain its position in the list as the fifth most deadliest cancer. Now I want to talk about the prostate cancer. This prostate, I have said I don't want to do anatomy, but there's a possibility people don't know which part of the body in male is called the prostate. You know, certain of these cancer, men and women share certain of these organs, like the lungs. Man has lungs, woman too has lungs, but when it comes to prostate is a unique organ in only male. Women don't have prostate, okay? It's part of the organ that play a key role in terms of reproduction, that is procreation. Now the prostate is located in the pelvic cavity. You have the thoracic cavity, that is the chest, the abdominal cavity, and the next one you have is the pelvic cavity. So anatomically, we're told that if you know walnut, the shape of walnut is about that kind of shape, and the prostate, the key role it plays in terms of reproduction. You know, during sexual intercourse, men produce one water like that, fluid. When they ejaculate, the spermatozoa is inside, then there is seminal fluid. Then the prostate also produces the largest aspect of the volume of that ejaculated. The largest aspect of it is from the prostate. Okay, I don't want to go more than that. Just know it. There is a reason why I'm mentioning this, so that we understand how this thing happened. And then the prostate is seen like the urethra is in the middle of the prostate, it surrounds the urethra. And then the bladder is below the bladder. Bladder is somehow like sitting somehow on top of it. Okay, then the what does the urethra does is the one that carry urine from the bladder. You know, bladder is the one that store the it store the urine reservoir. Then when somebody want to urinate, is that urethra like a pipe that convey the urine, and the person is able to urinate. But another organ that is very key, that is somehow related to this prostate, is the fact that the bladder, it is in front of, that is, the prostate is in front of the rectum, is directly behind the prostate. I'm saying it is key because I will talk part of the investigation that confirms the existence of that prostate when it becomes enlarged. And it's not every enlarged prostate that is necessarily cancerous, because we have the benign one. Some people will say innocent. There is an innocent growth that happens in men when they reach certain age. You see the person front become very big. That one is benign. That is an innocent growth. It's not cancer. But if investigation is not done, there's no how you will just see the growth and you conclude to be able to know whether the growth is an innocent growth, that is benign growth, or is cancerous. Now, what causes this prostate cancer? We have said that all cancers, no one knows the specific cause. You can't really say this is the thing that causes cancer. But there is what we call predisposing factors. It's an English word, those things that expose somebody to developing cancers. And I want to discuss that of this prostate cancer. I have said I will discuss the topmost in the list of the topmost 5 morbid cancers in men, that is cancer diseases that happen in men, and the topmost cancer mortality in men, that is the one that top the list of cancer that kills men. So that means we are dealing with prostate cancer and lungs cancer. So there's a possibility to discuss the lungs cancer, in the second video, so as not to make this video too lengthy. Now, the causes, I want to share it this way. We have the non-modifiable causes of cancer, predisposing factors of cancer, and we have the modifiable predisposing factors. They are English words. When we say something is non-modifiable, you cannot modify, you cannot change, you cannot do anything about it. Then we have the modifiable, those that you can be able to do something about it. Now, when you talk about the modifiable, non-modifiable, let me start with the non-modifiable. We're talking about age, number 1 here. Age. It's very rare for men to develop cancer. It's not that when they say rare, it doesn't happen too common like that, but it happens that from ages 40 and below, people develop cancers. But when you come to from ages like 50 and above, and the peak of it around that 65 years and above, like 70 something, that is the peak of it. People develop cancer. Now, this is age. There are things that happen. What the key thing about cancer, let me just talk as in general, in all cancer, what is happening? God put everything under control, that the cells that divide to replace worn out cells, or maybe cells that are injured, God put it, had it been cells get old and they are not replaced, people will not exist now. Because I started from the beginning, I say it's cells that make up tissue make up organs, and organs the entire body. So your bone now, there are cells that form the bone. Your kidney, there are cells that are formed. So the uniqueness of these organs also, there are unique cells that are laid down, during formation of baby in the womb. So, and even when we are giving birth to, these cells keep regenerating to replace the worn out cells, and then those that have been injured, maybe as a result of different types of injury, including injury as a result of sickness. So if they are injured in such a way that they have been tampered with in terms of their makeup, God so put a system that control those kind of cells can be wiped off. They say, this one has been wounded beyond staying, or maybe as a result of infection or one or two things. They say, let's just agree that this particular cell just wipe up. Then even if cells are going to replace, like in terms of worn out and what have you, there is a mechanism that control manufacturing of these cells. But if something happens, that some of these worn out cells escape being wiped out in the body, they will form a colony. I call them rebels. That these cells become rebels. They are able to survive. They run away from the body natural way of wiping out cells that something have happened to them. They have undergone, I don't want to use medical terminology, mutation. You understand? So these mutated cells, the DNA being the most very important aspect of the cell that is in the center of the cell, one part of the cell that is called the nucleus. Now they will escape this natural way of wiping up cells that have been affected. And what happened? They will find a way of surviving, and they too, they will start reproducing their kind. So this time around, they are not following order again. They have become rebels. They are not following the normal order that body try to check cellular activity. So they will start producing like crazy in an uncontrolled manner, forming tumor. And then because their texture, their makeup is not the one that will benefit the body, it begins to cause trouble. So in a concise way, that is what to say. Now, age. What bring about wrinkles? You see somebody is aging, you're shrinking, because the rate of cellular activity is reduced. There are a lot of things that happen around age. I don't even want to go into it, because if I go to, we might end up just talking about it, the age aspect of the predisposing aspect as far as this cancer is concerned. I don't want us to go, because the essence is not to go into that aspect. Is to just raise awareness for us to know that cancer can be cured, and there are things we can actually do to prevent the process from starting. So age is one of the predisposing factors, especially from 50 and above, the peak of it being 65, 70 something, like that. There are things that you cannot modify. There's nothing you can do about it. Then the second aspect is family. We inherit genes, genetic factor. Let me talk about the family first. They will tell you that an individual becomes risk of developing this group of diseases called cancers, most especially if a first-degree family member have developed this disease, like this prostate cancer. Who are the first-degree relation? Somebody's father, somebody's brother, the nuclear family, first-degree family. Then there are others like second-degree family, your uncle, brother to your father. Now, if a first-degree family member have developed this cancer, that especially before the age of 65 years, that person become high risk of developing prostate cancer. Then another grouping is that genetic factor, where there are some gene. We inherit gene now from parents, our genetic makeup, that determine even our makeup, our makeup, our appearance physically, like white person, black person, tall person, and all of those. So you can obviously see a family that somebody is mother and father short, they give birth to tall, fair children. you can't say this one they are not their children, because you don't know the gene from full parent. Maybe one of that gene is reappearing in this very generation. So there are some families that the person have inherited these mutated genes, one of which they call it this BRCA1 and 2. Just take it like that, okay? So it's when that person is exposed to certain other factors that can predispose that person to cancer, I tell you, that person will first become prone to this prostate cancer than that person that did not inherit the BRCA1 and BRCA2 gene. So these are there's nothing you can do about it. Then another aspect I want us to talk about is the modifiable risk factors. I just want us to talk about two. The other one that appear in most of these cancers, especially I don't want to say especially in men, because even women, they smoke. Is this smoking cigarette? Most cancer you will hear, they will say smoking, and it's something that you can modify. It's a lifestyle that you can decide to stop. We are told that there are about 4,000 chemicals that are associated with smoking, and out of which about 55 of them are known to be carcinogenics. They have the ability to predispose somebody to developing cancer. But what I want to talk about now is diet. This eating of red meat, it's not that it's not good though. Even the nutritive substance that we eat, we are told that whatever you eat, you should eat it with moderation. And we are told that this red meat, when subject to high temperature like this, high temperature, there are some chemicals that are released in the course of that, and they are not good for the body. So you imagine somebody consuming this red meat anyhow, especially when somebody reach these ages that we have talked about in the non-modifiable risks of developing this cancer. So you will be careful what you eat, because group of risk factors come together to make that individual to become very, very prone to developing this cancer. Since we don't know the real thing, but there are things that trigger whatever it is that is responsible for these cancers, and one of which is this, in the modifiable causes, is this red meat. So eating with moderation, especially when an individual reach a certain age, you are mindful of what you eat. And then the second aspect has to do with inactivities and obesity. When you see some men, you will see them, their abdomen is very big, as if they are pregnant, deposit of fats, and then there's a kind of work people do that make them to sit in one place for hours. I learned that these days there's this watch they encourage people to buy. I've forgotten the name they call it, to just enable you to be able to set up for that to beep once you have sit in one place for like up to an hour, so that you'll be able to get up. Whatever you are doing, once it starts beeping, you'll be able to get up, walk around. This exercise is not about how rigorous, but it's how consistent. That common walk of 20 to 30 minutes means a lot. So people sit for a very long time because of the nature of their work. It's something you can be able to modify, do something about it, or mind what you eat, because they are interconnected. When you eat anyhow, because this thing come from this red meat and animal fat, they are not good for the human body. Those are non-saturated fat, okay? They cannot be they easily attach to certain parts of this body. They are deposited there and begin to cause somebody to start adding up weight. Not only cancers, other system of the body can be in trouble. System like the heart, that's where people can easily develop heart issue, and people will just die like that. So I just want to stop at this two. So if you want to talk of the prevention, look around these causes, these predisposing factors, walk around it, and then most importantly, for those that believe in God and put their trust in God, that we also commit our life to God as we do all of this. But you cannot live your life anyhow, and then you are trusting that God knows. Wisdom is profitable to direct. Now, that is that about prevention. Since we have known these predisposing factors, is to work around it, to try to avoid, to adjust our life. And if we have known now that around that age is 50, and then the peak around 65, 70 something towards 80, then you begin to know how to adjust one's lifestyle. So frequent check, early diagnosis also will help one to be able to dictate it, and to be able to handle it early, because once it advances, it becomes an issue. And most especially when it now become advanced, live where it started, and have now started traveling, what we call metastasis medically, to the distant system or organs. So it become an issue, because at this point it must have ripped the body of other things, strength and what have you, because of disease process and the ability to even withstand the treatment. And there are some aspects of treatment, once there's advancement and metastasis, you don't even touch, like the surgical aspect. So they will only manage the person palliatively, that is just managing to make sure that to reduce suffering. And then even if the person will die, the person will not die a peaceful death. But if you want to attain this aspect, the curative aspect, which is real and is possible, is for us to put in mind this preventive aspect. And then constant checking. What are you checking? There's what is called protein specific antigen, that is PSA. Men are advised that, especially from that age 40 and above, there should be periodic check of this. And it's not saying that the normal value is from 0 to 4. It's not saying that anything that is more than that it must be prostate cancer. But it will now raise an alarm for other investigation to be done. And to also, you want to check to see, is it because of certain factor? If there's anything that constitutes pressure around here, it has a tendency to make it to rise. Or a man that have just had sex and have ejaculated, or it could be as a result of that innocent growth that is called benign, that I said is referred to, and that one is not cancerous. So there are so many factors that can make one to elevate, that is to go up. But at least if you do this periodic check, it will give a clue. That's when other investigation can be done together to be able to rule out whether this one is the innocent one, or the elevation is as a result of certain of these factors that I mentioned, or is cancerous. So at that level where there is no enlargement, it has not started bringing about interfering with urinary pattern and what have you, then something will be done. Then there's another one that is called, you can actually do scan. You can actually do scan. Scanning will be able to reveal the size. And then there's another aspect that is called digital rectal examination, where doctors goes with glove hand. That was where I mentioned the anatomy, the relationship between the rectum and the prostate. So they will be able to use their glove hand to go through the rectum. If the enlargement, they will be able to feel the enlargement. Not only feeling the enlargement, they will be able to know whether the edge is smooth or it has rough edges, to begin to give clue. Maybe this one is undergoing some cancerous changes. And then that is not also enough to conclude. The scan, prostate scanning, the digital rectal examination, until biopsy is done. until biopsy is done at this point in time, to be able to, it all depends again on this level in which the person presents to the hospital. So biopsy will be done where a little tissue sample is taken from the prostate and is taken to the lab to undergo a histopathology investigation to be able to see the cells that are there. They know the normal morphology of the cells that constitute that prostate. If they have become differentiated, that they have started changing, not resembling what the normal cell should be, it can be diagnosed at that stage, and then something will start immediately. They will start treatment. There are varying forms of treatment, but the essence of this video is to let us know that prostate cancer is about the highest cancers that occur in men. It tops the list, and it is treatable. Somebody that presents early can actually be cured of it. And to also tell us that there are some group of things that should be avoided, that somebody can become cancer-free if that person is able to avoid those factors we have discussed from the beginning that causes, predisposes somebody to occurrence of cancers. So if that one is known, it's for one to be able, those that are modifiable and those that are non-modifiable, it still have a lot to do with the lifestyle of an individual, so that you know that if someone have had a first-degree relation that have died based on cancer or have developed cancer, then you should know you are at risk. You should adjust your lifestyle. We are saying that they are non-modifiable, but one is linking to others so that you'll be able to know what to do. Thank you so much for listening. The second video, we are going to be talking about lungs cancer before we now discuss the cancer that top the most top, the 5 cancers that top the list in women and then in children. Thank you so much. For those that have lost relation due to any form of cancer, I say may the Lord comfort you. And to those that are battling with cancer out there, I say may the God of heaven visit you and heal you in Jesus' name. And for those that have lost, that have relations that are battling with cancers that don't have means of treatment, dig deep. There are organizations, if you are able to make investigations, that are there giving support all over the social media. Sometimes you will just see a post, they will say, if you have somebody that is suffering from breast cancer, suffering from so cancer, contact so number. God will help us in Jesus' name. Thank you for watching.